Have you ever wondered what Reye's syndrome is? Well, let's dive right in. Reye's syndrome is a rare yet serious condition that primarily affects the brain and liver. Now, although it's uncommon, it's important to know about it because it typically emerges in children and teenagers, often following a viral infection. That's right, something as common as the flu or chickenpox could potentially lead to this serious condition. So it's not something we can afford to ignore. Recognizing it early and understanding its symptoms is crucial, as it can make a significant difference in the outcome. Now that we've scratched the surface of what Reye's syndrome is, are you ready to delve deeper into this significant health topic? In the upcoming segments, we'll explore how to recognize Reye's syndrome, its causes, treatments, and most importantly, how to prevent it. Join us as we delve deeper into this significant health topic. Identifying Reye's syndrome early can make a real difference. As we already know, Reye's syndrome is a serious condition that primarily affects the brain and liver of children and teenagers, often following a viral infection. But what does this mean in practical terms? How can you recognize the signs and symptoms? To start, one of the most common symptoms of Reye's syndrome is persistent vomiting. This isn't the occasional upset stomach or a single bout of sickness. We're talking about repeated, uncontrollable vomiting that doesn't seem to let up. Next, confusion. This isn't your run-of-the-mill forgetfulness. It's a profound disorientation that might seem out of place, especially in a young person. They might not know where they are, who they are with, or what they are doing. Seizures are another symptom to be on the lookout for. These are sudden, uncontrolled electrical disturbances in the brain. They can cause changes in behavior, movements, feelings, and levels of consciousness. If you see someone experiencing a seizure, it's a medical emergency. Finally, sudden behavioral changes. This could mean a normally calm child becoming excessively agitated, or a typically outgoing teenager withdrawing and becoming unresponsive. These changes might seem subtle, but they are significant. You might be thinking, these symptoms sound severe. Wouldn't I notice them right away? Not necessarily. The symptoms of Reye's syndrome can sometimes be mistaken for other conditions, or they might not seem that serious at first. That's why it's so important to be vigilant and to take these signs seriously. If a child or teenager has a viral infection and begins to show any of these symptoms, seek medical attention immediately. Don't wait for the symptoms to get worse. Don't try to diagnose the condition yourself. And most importantly, don't give them aspirin or any medication containing salicylates. Remember, swift action is key if these symptoms appear. Reye's syndrome is a serious condition, but with early recognition and proper medical care, it can be managed effectively. Unraveling the cause of Reye's syndrome isn't straightforward. It's a bit like trying to solve a jigsaw puzzle with some pieces missing. But even though we don't have all the answers, we've managed to piece together some important clues. So, what do we know? Well, we know that Reye's syndrome typically emerges in children and teenagers, sometimes following a viral infection like the flu or chickenpox. But there's more to the story. There's a strong association between the use of aspirin or salicylates during a viral illness and the onset of Reye's syndrome. Now, it's important to remember that correlation does not mean causation. Just because two things occur together does not mean one causes the other. However, the link is strong enough that health professionals advise against the use of aspirin in children and teenagers who are recovering from a viral illness. This doesn't mean that aspirin is inherently dangerous. Aspirin is a common over-the-counter medication that's been used for decades to relieve pain and reduce fever. But when it comes to viral illnesses in children and teenagers, it's wise to err on the side of caution and choose alternative medications. And what about salicylates? Salicylates are a group of drugs, including aspirin, that are used to relieve pain and reduce inflammation. They're found in many over-the-counter and prescription medications, so it's crucial to check the ingredients of any medication given to a child or teenager, especially during a viral illness. While the exact cause of Reye's syndrome remains a mystery, we know enough to take preventive measures. Being mindful of these potential risk factors can help protect your loved ones from this serious condition. The key is to stay informed, be vigilant, and always consult with a healthcare provider when in doubt. While the exact cause is still a mystery, it's important to be mindful of these potential risk factors. So, how do we tackle Reye's syndrome? It's important to understand that there isn't a specific cure for Reye's syndrome. The focus is on supporting the body's vital functions and treating any complications while the body fights the disease. This is often referred to as supportive care. Supportive care begins at home, where parents and caregivers play a crucial role in recognizing early signs and symptoms and seeking prompt medical attention. Once in medical care, treatment is customized based on the severity of the symptoms and the patient's overall health status. In severe cases, hospitalization is necessary to closely monitor the affected individual's health. This allows medical professionals to intervene promptly if the condition deteriorates, preventing further complications. The hospital setting provides access to critical care services, including respiratory support and measures to reduce brain swelling if necessary. In addition to managing symptoms, treatment also involves managing any metabolic abnormalities. This might include correcting blood sugar levels, electrolyte imbalances, or acid-base disturbances. The goal is to ensure the body's vital functions are maintained while the body recovers. While in hospital, the medical team will also monitor the patient for potential complications, such as respiratory failure, seizures, brain damage, and cardiac arrest. If these occur, immediate interventions are necessary to stabilize the patient. This sounds quite intense, doesn't it? Yes, it can be. But remember, the earlier the treatment, the better the outcome. That's why it's so important to recognize the signs of Reye'S syndrome early and seek immediate medical attention. Remember, every patient is unique, and treatment plans will vary. The key is to work closely with your healthcare provider to develop a plan that's tailored to the patient's specific needs. Reye'S syndrome is a serious condition, but with prompt recognition and comprehensive supportive care, most patients can recover completely. So if you see the signs, don't hesitate to seek help. Remember, early medical attention can significantly improve the outcome. Prevention is better than cure, especially when it comes to Reye'S syndrome. When it comes to safeguarding our children and teenagers from this serious condition, there are a few key strategies that we can deploy. Firstly, and perhaps most importantly, is the avoidance of aspirin during viral illnesses. Aspirin, or salicylates, have been linked to the onset of Reye'S syndrome in the wake of a viral infection. This makes it crucial to be cautious when it comes to administering these substances to children and teenagers who are unwell. Instead of aspirin, consider alternative medications. There are many over-the-counter and prescription options that can be used to manage symptoms of viral illnesses without the associated risks. Your healthcare provider can help identify the best alternatives for your child's specific needs, so don't hesitate to reach out for advice. But prevention doesn't stop at medication management. Keeping vaccinations up to date is another key strategy in preventing Reye'S syndrome. Certain viral infections can trigger the condition, so safeguarding against these viruses can significantly reduce the risk. Regular immunizations in accordance with your healthcare provider's recommendations can go a long way in ensuring the health and safety of your child. It's also worth noting that while these prevention strategies are crucial, they do not eliminate the risk entirely. Reye'S syndrome is a complex condition with many unknowns, so it's important to be vigilant for symptoms if your child is unwell, even if you've taken all the recommended precautions. Swift action can make a world of difference in the outcome. So, to sum it up, preventing Reye'S syndrome comes down to 3 key actions: avoiding aspirin during viral illnesses, using alternative medications, and keeping vaccinations up to date. It's about being proactive, informed, and vigilant in our efforts to protect our children and teenagers. By taking these preventive measures, we can help protect our children from this serious condition. So, that's a wrap on Reye'S syndrome. We've journeyed through the essential aspects of this rare but serious condition that affects both the brain and liver, primarily in children and teenagers. We have learned that recognizing it early is crucial. Keep an eye out for persistent vomiting, confusion, seizures, and sudden behavioral changes. Remember, swift action can make all the difference. While the exact cause remains somewhat elusive, we've seen that there's a clear link to the use of aspirin or salicylates during a viral illness. Therefore, it is vital to be cautious with medications containing these substances. As for treatment, it revolves around supportive care, and hospitalization may be necessary for close monitoring and interventions. Prevention is indeed the key, so consider alternatives to aspirin during viral illnesses and ensure vaccinations are up to date. Thanks for joining us today. Stay tuned for more informative content.